It was great to be with you at Cracking the Code in Rochester earlier this month. I really enjoyed connecting with so many of you and learning about what is happening on the ground in your healthcare organizations every day. Advisix works with healthcare systems across the country. And what you have in Rochester, the community, the collaboration of medical organizations there, it really is special and unique. So thanks for having Advisix as part of that. I'm Jennifer Trammell. I am our Healthcare Vertical Director. I was thinking with Halloween right around the corner, we could talk about some scary things today, things that go bump in the night. Things like cyber attacks, messy closets, and that feeling when your boss comes up to you and says, "Hey, where are we on?" And you have not started that project yet. Scary stuff. Now, I don't want to just scare you. I'll share some examples of how other healthcare organizations are taking control of these frightening things. First, let me provide some context about how Advisix fits into this harrowing tale. Everything you do comes back to patients, right? That's what healthcare is all about. You and your teams do that every single day, taking care of people. And several times throughout the course of that work in a day, you use a computer or another tech device that's magically connected to everything else that you need, right? Well, what you don't see is the technology and the infrastructure that underlies all of that. Like any modern business, IT is the backbone of your organization, and it really supports your critical work. So what does all of that entail? Well, we mentioned computers, electronic health records are also a big part of your IT system, of course, and those medical devices that are connected. We rely on Wi-Fi for connectivity. We have to protect who has access to that information. Think when you scan your badge, you might use Vocera or Imprivata. And of course, we need layers of security to prevent cyber attacks and keep information secure. All of this is part of your IT environment, and it fits with your underlying infrastructure, whether that's on-prem, in a co-location, or in the cloud. And it's not only supporting doctors and nurses and patients on the floor, this infrastructure is also what supports your hospital system's back office that allows the business to function. Advisix helps organizations look at their IT from a holistic view. We talk about your key needs, and we love digging into those challenges. And together we can design a system that makes sense with the right pieces of technology. Now, often that is working right alongside your IT team. Sometimes it's taking over work that you need to outsource. Getting all of these things right, these pieces of technology, it includes dozens of partners. And these are some of our most important strategic partnerships. But it doesn't end there. We partner with nearly 150 different technology providers. We have vetted their solutions. We know the ins and outs. So our job is really to understand your unique needs. And then we can make smart recommendations about the right technology to help you achieve your strategic goals. We see things through implementation and ongoing management and support. We go out there, we get that technology, you have one point of contact, and you're not managing 150 relationships. Make sense? All right, I told you, we're going to talk about some scary stuff. So this is you. You wake up in the middle of the night. It's pitch black, obviously. So you roll over and you see, 2:39 a.m. And you think, okay, good. If I fall back asleep now, I can get about 3 more hours. But then your brain starts turning, right? So for CISOs, CIOs, CMIOs, CTOs, what's one of those things that's keeping you up at night? Well, if you're like some of the other healthcare tech leaders I've talked with, one of those things is cyber attacks. These guys who are working through the night to infiltrate your systems. And you know what? Healthcare IT leaders have very good reason to worry because these nightmares are coming true. You probably know healthcare is the most attacked sector. We got to do a little math here. Now, this does not count as a scary thing because I did it for you. So let's take a look back in 2022. There were 1,463 cyber attacks per week globally. Well, that breaks down to 209 attacks in healthcare every day. We're talking 8 attacks an hour, or an attack every 7.5 minutes. So really, these are just numbers. What does that actually mean for an organization like yours? Well, I like this context from Lancer Gates. He's president of the Missouri State Medical Association. And here's how he laid out the situation in a paper published earlier this year. He said, once attacked, hospitals must either 1, pay a ransom to the cyber attackers, which incentivizes and perpetuates future attacks on more hospitals, or 2, go on downtime. The average downtime for hospitals in 2022 was 24 days, with an average cost of $10 million. So either way, accesses and resources for medical services are both compromised. And you know, the nightmare scenario, you've probably thought about this yourself, is simultaneous cyber attacks at 2 or more hospitals in close geographic proximity. This 2-hit hypothetical, that would compromise access to care for patients who have time-critical diagnoses. We're talking trauma services, strokes, heart attack. So why target healthcare? Well, like so many things in our world, it comes down to money, which actually looks more like this with Bitcoin, but I guess it's really that, huh? It's all about the value of the data to those malicious players. Kristen Tott, she was with the Cybersecurity and Infrastructure Security Agency. She says it is absolutely motivated by profit. It is an economic model. And the tragedy is it's an economic model that happens to capitalize on infrastructure that is responsible for human lives. So that's what we're up against. In a nutshell, this is the equation. This is the value. This is what you store. You have personally identifiable information, protected health information, medical records, financial credit card records, right? All wrapped up with some intellectual property. So those 3 Ps plus the IP, that equals big bucks. And that is the information that can be leveraged for ransom. And it is valuable on the black market to sell. So how do you keep this from happening to you? Well, I'm going to add to that scary because AI is turbocharging the speed and scale of attacks. I want to give credit to Palo Alto here for pulling this data together. Look at how long it used to take us to build ransomware, 12 hours. Where are we headed? 15 minutes. What about compromising and exfiltrating that data? 9 days. Where are we headed? 20 minutes. And to exploit that kind of vulnerability, going from 9 weeks to less than an hour. You know, we think of AI as an amazing tool for us. It's also an amazing tool for bad actors. And as healthcare professionals, we like to look at, all of the possibilities with AI, from streamlining those back office processes to personalized medicine. Unfortunately, there are also people in this world who are looking at how can I use AI to further their own productivity when it comes to malicious areas. And I hate to say it, but bad actors are running businesses just like we are. So as a doctor's thinking, I can see more patients, someone's out there thinking, I can see more patients' data. I can increase my productivity. Yeah, me too. Increased revenue. Yep, more dollars coming in. I can reduce infections with this. I can reduce the time to infect. I can reduce the time to care for patients with AI. This guy's saying, yeah, I can reduce the time to scare. That's what we're up against. Wait, this wasn't supposed to be one of those scary things. Anybody else get some heart palpitations with a Scantron? Well, here's the deal. When it comes to cybersecurity, you don't know what you don't know. And that is why it is so important to test your environment. Let me give you an example from a customer we were working with. Because it's security related, I want to be sensitive and respectful of their privacy. I can tell you it's a medium-sized healthcare organization in the Northeast. Their team brought us in to do an assessment. We identified where they had security gaps. We put together a plan of action, and we prioritized everything based on the risk to their organization. So we created a strategic plan that not only reached their compliance needs, but also made the entire environment more secure. And here's the important thing. In that process, we identified gaps that they were completely unaware of. I'll give you an example. It was a configuration issue. They didn't realize that they weren't securing transmissions. This was part of a back office process, and it was for a system that was used to process patient records. So I was talking with our security experts, and I said, what should this group of healthcare IT professionals in Rochester know? And he said, if there's one thing they could take away, it's you're not alone. Historically, healthcare has been a little behind the time. There are a lot of healthcare organizations out there who feel like we need to be doing so much more. And everything changes so fast when it comes to regulations, when it comes to moving to the cloud. And that is why we are here, to help with industries like healthcare that need that extra support. So the easiest thing, please take the time to do an assessment so you know what is going on in your organization. Look at how your environment compares to the healthcare industry. Are you compliant? Which regulations are you subject to? Because you don't know what you don't know. Phew, we made it through our first scary thing, cyber attacks. But there are two more. All right, for this next one, close your eyes. Think about your health system's data, all of the patient records, x-rays, MRIs, payment history, employee information. Think about where all of that lives. On a server at your hospital, in another location, in the cloud. How is it organized? Set that image aside for a minute, keep your eyes closed, and picture your closet at home. Got that image in your head? All right, go ahead, open your eyes. Does your closet look anything like this? Does your data look anything like this? I'm guessing some of you have your skin crawling there. Well, what's the deal with messy closets? It can be like our messy data houses. And why does that matter? Well, with AI, we have been told time and time again, garbage in, garbage out. So the first thing you have to do is get your house in order, get your closet organized. Now, this is lovely, and I do think every closet should have a chandelier. But if we were to do the equivalent of this for our data houses, we would spend the next 5 years and millions of dollars on just that and never actually accomplish anything with AI. So let me give you some good news for those of you who are at the beginning of your AI journey. You do not have to renovate the entire closet. You just have to get one corner in good order. Great, right? Well, how do you know which corner? That is exactly what we have been working with healthcare organizations. We've been sitting down with their IT teams to figure out. And here's the secret. It does not start with AI. When we sit down for an AI workshop, it starts with you and your organization. What are you trying to accomplish? What problems are you trying to solve? Then we can talk about AI. We can talk about some other tools too that can help you get there. So to start putting things into action, we have to figure out what information we need and where does that useful data live. Let's focus on that. That is the corner of the closet that we have to have in good order. So what problems are you trying to solve? Here's what we've been hearing from healthcare organizations lately. They are trying to consolidate data, reduce technical debt, close loopholes, but it's bigger than this. We need to reduce risk, ensure compliance. On the patient side, we're excited about virtual monitoring that can help support our limited clinical staff. We're looking at how do we automate some of these administrative tasks? What about AI-powered billing and automation? Intelligent claims processing. I think a lot of us are looking at how to counter this really challenging payer environment right now where we're seeing increased denials. What about diagnostics, improving accuracy? How do we reduce the time to diagnosis? All of these are things that healthcare systems across the country are working on with the help of AI. And I like this really holistic view from Stephen Del Rossi. He's the CFO and interim CEO of Northern Inyo Healthcare District, that's out in Bishop, California. And he says, we are building an integrated neural network that takes all routine, tedious, and monotonous tasks, as well as those designed to improve patient care. And they are blending them together to ensure our patients' care is of the highest quality, from the front of the house through clinical work and into final billing. So remember, we're starting with what problems are we trying to solve? We're identifying the useful data that can help with that problem, and we're getting it in good order. That's the corner of the closet. And by doing that, that's what will allow us to experiment. To start small with AI, to demonstrate proof of concept, and get to the good stuff sooner. Get to solving these problems sooner. I don't know about you, but to me that sounds like fun. Now, there can be some resistance to AI, and you know what? There should be caution. We need smart guardrails in place. So here's a carrot, an incentive if you're seeing some resistance. And you know what? Actually, it is so good, we can turn it into a carrot cake. By 2026, AI applications are predicted to save the US healthcare industry $150 billion annually. And you want to capture your slice of that pie or cake. All right, with the carrot comes the stick. Here's the deal. 50% of employees using AI, they're doing it without permission. And that is why it is so important to take control of your AI strategy, to identify risk, to put smart guardrails in place, and to really get clear on how you want to use these advancements to help your healthcare system. Phew. We have made it through cyber attacks. We've been through the messy closet. There is one more scary thing we got to deal with. And that is the feeling when your boss says, hey, where are we on XYZ? And you know, you haven't even started yet. And the reason you haven't gotten to it is because you are busy putting out fires every day. And some ignite unexpectedly with a small spark. Some of them are more like that controlled, slow burn. Example, your IT team is responsible for patching and updates. And it's critical because this is an easy in for cyber attacks if it's not done correctly. Well, we analyzed that process with a healthcare organization in Tennessee, and we started looking at the number of hours the team was spending on work like this every single week. It was significant. And by offloading the scheduling and coordination of all firmware updating activities, they magically got that time back. So some of you might be thinking, if we could save those hours, what could we do with that time? How about some revenue generating tasks? How about preventing turnover of those positions because they get to work on something fun? It reduces your hiring and onboarding costs. It increases the expertise you get to retain on your team. These kinds of services are usually more cost-effective to offload. It frees you and your team up to focus on the important things that make a difference to you, that make a difference to patients, and that make a difference to the business. And it's the kind of strategic initiatives, frankly, that make you look good because you are helping to move your mission forward. You know, I have yet to meet an IT team in healthcare or, frankly, any business that's sitting around saying, I have all of the staff, all of the resources I need to accomplish everything we're supposed to do. It's not happening. We need technology. We need smart applications of technology. We need AI to take over those routine tasks and put the people where they matter most, with patients on front lines and on strategic projects in the back office. We have made it through some very scary things together, my friends. Advisix is here. We are here to walk side by side with you and shine the light into those dark corners. Just like you're here to help patients, we are here to help you. We are here to illuminate your path, to enable you to do IT better, faster, and get you back to some sweet dreams. Doesn't that sound good? I'm Jennifer Trammell. I'm the Healthcare Vertical Director here at Advisix, and please reach out if we can help you with any of these scary things. We've got a flashlight ready to go.